I'd like to bring Dr. Mindy Fullilove into this conversation now. And I'm just reminded that it was in the 1990s that this new frontier for capitalist development in Harlem emerges. It's a kind of development that proposes to produce mostly low-paid service jobs with absolutely no benefits. At the same time that the largest employer in Harlem, you might recall, Harlem Hospital, is experiencing a gutting process because of the budget cuts, right? So, and this was also a moment when there was the massive transfer of wealth from the bottom of society and the middle class and working class to the top was on its way. Dr. Mindy Fullilove, would you add to this conversation on the structural roots of displacement?
Yeah, glad to. I think that the story actually goes back to the 1950s, so that there's 40 years before you get to the 90s when various pieces of this are being put in place. And at that time, Harlem had some important radical leaders. And so McCarthyism comes in and those radical leaders get wiped out. Some get deported, others get sent to prison. And so basically the commitment to on the part of the political leaders to the grassroots is shifted. That's one piece of it. Then that's followed in rapid succession by urban renewal, which takes out parts of the community and parts of New York City. It's followed by deindustrialization. So people that have good union jobs are losing them. The Regional Plan Association promotes the idea that New York City shouldn't have any factories. All the factories should get pushed somewhere else. So union jobs are disappearing. Then there are a whole series of epidemics, none of which are properly managed. We're seeing this kind of impropriety now with COVID, but it's been going on in Harlem for a long time. So there was a heroin epidemic, then a crack epidemic, then a violence epidemic, multi-drug resistant tuberculosis, a long list of epidemics, all of them badly managed, so that people suffered morbidity and mortality at very high rates. Then you get into planned shrinkage. So Harlem loses 30% of its built structure, its buildings, between 1960 and 1990, which is catastrophic for the social organization and the social strength of the neighborhood. And so at the point at which we get to the 1990s, Harlem is really very chaotic as a place. It's very, very difficult. 30% of the housing is gone. There's, rats and garbage everywhere. People are sick with AIDS, with addiction. It's at that point that Doctors McCord and Freeman publish a paper that points out that a black man in Harlem has a less life expectancy than a man in Bangladesh, which is at that point the poorest country on earth. So this sort of shocking disparity of health is showing up at that point. So at that point the neighborhood is politically weak and has there are many organizations, but they don't really have the kind of power that existed in the community in the 1950s. So how does the community defend itself? It's not really able to defend itself. It's not even able to take care of itself. So it's a long time coming. When Roger Starr talks about starting planned shrinkage, he said, let's clear the land where the poor people are, clear it, and let it lie fallow until we know what we want to do with it. So he was not asking the people in the neighborhood, and he was really literally burning down their housing. So the recent film Decade of Fire, which I'm sure you've seen, which is more about the Bronx, but it's the same story in Harlem. So this is catastrophe on catastrophe on catastrophe. And I'm not sure if that answers your question, but sort of like this whole series of upheavals have torn the social fabric and left people incredibly vulnerable to sickness and to death.
Thank you, Dr. Fullilove. That definitely paints a picture for us. I Can you tell us a little more about the infrastructure of planned shrinkage, and how did the individuals behind this idea get away with it? Because I'm not sure that our listening audience understands the ABCs of this process, its genesis. Just give us a little more detail on that.
So planned shrinkage is implemented in the middle of the 1970s. The idea is that New York City is losing population, and the proposal is made that they should shrink the footprint of the city. And they're going to do this in minority neighborhoods. So they're going to pick neighborhoods that they think are flourishing and keep them, and then close fire stations in other neighborhoods and let them burn down, move the people, and the people will then move to the neighborhoods that they're going to save. Roger Starr, who's one of the architects of this in city government, says at the time that he predicts that New York City in the future will have a population of 5 million people. Obviously, he missed the boat. So how they got away with this is, to me, really one of the great questions. How do you burn down the city by, malign neglect of, closing fire stations? And this was known. There were hearings in the New York State Assembly about this. So the firefighters unions were protesting this. It was well known that this was happening, yet somehow it was argued that this was okay. And what's also really fascinating to me is, as you were saying, people who are listening might not know, if you ask people in New York or anywhere, but in New York, what happened in the Bronx, what happened in Harlem, they would say the landlords committed arson. They wouldn't say there was a public policy of planned shrinkage. And even today, when people are recounting the history of that period, they don't say there was planned shrinkage. So not only did they not get called out on it then, they've managed to keep it a secret, like a covert, like a covert operation, which is really stunning. And one of the problems with it being a covert operation is that then planners can go into other cities. They can go into Detroit, they can go into Youngstown and say, well, planned shrinkage is a really great idea. Let's do that. And the costs of it are just pushed aside. Like, no, it's a great plan. There's no problem. But planned shrinkage is crucially connected to the spread of AIDS. Dr. Roderick Wallace estimates it killed 100,000 people. So it's a horrific policy. It was kept pretty much under wraps at the time and has remained that way. I don't know how you take the lid off and really get planned shrinkage into the conversation.